Good morning. Good morning, everyone, and welcome. I'm Cliff McKinney, Vice President of Sales at The Hill. Thank you to everyone joining us online and in the room for our event, Health Safety Net Programs Will Older Adults Fall Through? I'd like to thank our sponsor, Alliance for Aging Research, for their support of this very important discussion. Federal health policy has seen major shifts recently. Most notably, millions of people could lose health coverage if the current reconciliation bill's Medicaid cuts become law. In addition, the House of Representatives recently passed a new budget resolution that calls for cutting trillions of dollars from Medicaid, SNAP, and other essential programs that older adults rely on to meet their daily needs. Workforce cuts across the FDA, NIH, CDC, and the Administration for Community Living Health are hitting the country's medical research infrastructure, food safety, and infection surveillance, and support for critical local programs such as Meals on Wheels. At the same time, there are opportunities for positive change. Congress is considering the Ensuring Pathways to Innovative Cures, or EPIC Act, bipartisan legislation that fixes the IRA's pill penalty by leveling the playing field for all types of medicines and ensuring adequate incentives for new drug development. There are also increasing calls for accountability of PBM middlemen and Medicare Part D plans to rein in excessive profiteering and utilization management. What do older Americans need to know about these changes? What are the greatest risks and consequences of these new policies? And what can be done to ensure patients don't lose out on the care that they need? Today we'll hear from legislators, policy experts, patient advocates, and healthcare leaders to examine how older Americans are impacted by this time of rapid change. Before we get underway, a few housekeeping notes, please. If you're with us here in the room, please keep your phones on silent for the duration of the program, but please join the conversation on social media. You can follow us on Facebook, X, and Instagram at The Hill Events using the hashtag #TheHillHealth. And with that, I'm happy to introduce our moderator today, Julia Manchester, national correspondent at The Hill. She's joined by Democratic Congresswoman Judy Chu of California.
Good morning, everyone, and good morning, Congresswoman. Thank you so much for joining us during a very busy time in Washington. I guess not much is going on. You know, I've been up on the Hill this week following House Republicans in particular as they seek to rally around President Trump's legislative agenda. And even though House Republicans, at least for the past few days, have been the main story as they push forward through that, we know that this proposal could very well affect Medicaid, SNAP, and other community programs. SNAP is obviously a food assistance program. Congresswoman Chu, I wanted to get your sense of what's at stake for older adults in particular, and what is the Democrat strategy to push back in the minority?
Well, the proposal by the Republicans for this reconciliation bill, the big, beautiful bill, but really is the big, ugly bill, is the most devastating cut to services for seniors in our lifetime, or the nation's history, I would say, because it is proposing $880 billion worth of cuts to Medicaid and over $300 billion worth of cuts to SNAP. Now, Medicaid is, of course, the lifeline for so many seniors. It is a major funder for nursing care, long-term care for seniors. And of course, we know that there is such a close relationship between Medicare and Medicaid. When Medicare does not cover something, it is Medicaid that steps in. So long-term care, home care, those are things that Medicaid can pay for, but without Medicaid, Medicare will really not cover the whole thing. And in fact, hospitalization by Medicare will cover about 28 days, but after that, Medicaid takes over. So this will be really tough for seniors if these cuts go through. And as far as SNAP benefits, we know that they increased the amount of cuts to SNAP in this last budget markup. And the 98% of those that use SNAP benefits are children, elderly, and the disabled.
Right, right. And, looking back, over the past few months, we know that there's been a number of town halls Democratic lawmakers have had, also some Republican lawmakers, but we've seen a number of very impassioned town halls, including about some of these potential cuts. What are you hearing from your constituents in Southern California?
They are incredibly fearful, anxious, and they feel devastated about the potential cuts that could happen to them and to their fellow neighbors. I have never seen such passion in my life. They have turned out in record numbers at the town halls. They pack each one of them, and it's usually standing room only. They have gone to so many rallies and protests, and they have been in places that were not known for protests. I know that on the hands-off day, the hands-off rallies,
right.
I went to 4 protests, 2 in Pasadena, 1 in Rancho Cucamonga, 1 in Claremont. And Rancho Cucamonga is very unusual because that's a rather conservative area,
right.
But they came out in record numbers, and they packed the sidewalks and brought their homemade signs, but they were very impassioned, and you couldn't even walk along the sidewalks. There were so many people. So I've never seen anything like that. It was a very organic, but it's very clear that Americans all across the country are feeling these devastating cuts very personally.
So we're seeing these protests, we're seeing this large attendance at town halls, but what does the response look like from Democrats going forward? How can they organize, and what is the strategy when you're in the minority, which is a tough spot to be in?
Well, we need to do everything. And what I always say to my audiences is that we need to legislate, litigate, and activate. So on legislation, we are introducing so many bills and so many letters that are protesting each one of these cuts, and scores of legislation, as a matter of fact, to preserve the system as we know it, because I must tell you, every single one of these cuts is illegal. These are cuts that were appropriated by Congress, and they cannot just do away with these cuts as they please. That is not legal. So that brings us to the next one: litigate. We have more coordination than ever from the legal community. It is coordinated by Democracy Forward, which has been able to mobilize the legal advocacy groups, and as well as the state's attorney generals, who have been all coordinating to meet the moment each time one of these actions takes place. And in fact, they've anticipated these cuts and have put the litigation through right away. And they have been successful in stopping nearly all of these actions. Thank goodness we still have the 3 branches of government. So the judges are, in fact, stopping these actions and stopping the dismantling of the programs that were approved by Congress. And the third part of this is activate. And that is making sure that we do our town halls in greater numbers, that we reach out on social media. We've encouraged all our constituents to tell their stories about how these cuts are affecting them. And I have gotten hundreds and hundreds of stories from people in my district. And of course, we're telling them to go to the rallies and to participate. I encourage them, no matter where they are, to be able to have a town hall, to protest, to have a meeting, because we need to grow these numbers. People need to see that the American people are upset, and that we need to ensure that these numbers grow, because what I always tell them, they say to me, well, I'm just one person, what does that matter? And I always say to them, look, 1 turns into 10, turns into 1,000, turns into 1,000,000, and we need millions of people to be protesting all of this.
We know that senior citizens are one of the most reliable voting blocs across the country, and another form of pushing back or resistance, you could say, is voting. And we know that Democrats have really sought to make this a major campaign, a political issue, obviously campaign issue, over a year out from the midterms. What can we expect in terms of, I don't want to say targeting seniors, but galvanizing seniors ahead of the midterms? I imagine this is an issue that, understandably, I don't want to say excites, but mobilizes.
So one glimmer of hope are the midterms. So November 2026 is when we can at least take back the House and stop the worst of these actions. So that is one thing that seniors can really put their energy in. Now, we, the Democratic caucus, have targeted 35 seats where there is some change that is possible. And we just need 3 seats. The margin is so slim right now that Republicans are running around trying to get their different factions to buy into this so-called big, beautiful bill. And make sure that they get all votes, and that these votes don't stop this bill. But it's pretty tough when basically you could just have 4 Republicans join together and they could stop this entire thing. So that's how slim the margin is now, and that's to our advantage for the midterms. Now, in the midterms, typically the president's party loses seats. So that's just typical. But what we have now is the lowest approval rating for Trump ever. So we have that on our side. We have masses of Americans that can see democracy is in danger, that the rule of law is in danger, but most importantly, that the basic programs that we've come to rely on, Medicaid and SNAP, are in danger. And actually, with regard to the elderly, Social Security is in danger as well, because there have been thousands of cuts in the Social Security offices around the nation. In fact, Trump is threatening to close down at least 47 Social Security offices. He's cut thousands of these workers and has done such things as threatened to cut off the phone line. Actually, for a while, he did cut the phone line at the Social Security offices, but there were so many protests that they had to reinstate it. And so I think Social Security is in danger as well, and that is what alarms so many of the elderly. So what we are saying to the elderly is we have a big chance here to change things, and your participation in these elections is so important. The seniors in our nation can help with such things as postcard writing. This is something that I noticed they really love to do. Postcard writing to those targeted seats, and making sure that people know what is at stake, that personal message that they can tell the folks. The phone calling is something that they can safely do while in the comfort of their own home or in an office that is nearby them. They can have a huge impact on the outcome of this election.
Right. A lot of conservatives in the House seem to be very concerned about the prospect of this bill going to the Senate, because we know that, just obviously senators have a very, different, broader constituency. I thought it was notable that last week Missouri Senator Josh Hawley was, railing against Medicaid cuts, saying his constituents in his state would be impacted. Is there any hope, I guess, from your perspective, of maybe some Republicans pushing back? I mean, you mentioned that in some conservative parts of Southern California, there has been concern about this. Have you heard that concern from some of your Republican colleagues?
Well, there were 12 Republicans that wrote a letter saying that the Medicaid cuts should not be so deep. And they have a reason to be worried. David Valadao, for instance, in Central California, has a population of Medicaid recipients that is huge. It's 67%. And so if they lose Medicaid, you have a great number of people in his district that will vote against him. In fact, he's lost previous elections. The one he lost was when he voted against the ACA, the Affordable Care Act. So he knows that there will be an immediate reaction if he votes against these Medicaid cuts. So yeah, these Republicans in the House have expressed their concerns, but I think that in the end, Trump will twist their arms so strongly and do a combination of methods, whether it's bribing or threatening, and that they will cave. I think the ones in the House will cave. I think that this bill will ultimately go to the Senate, and what is more interesting is what will happen in the Senate.
Yeah, yeah.
Because you're right. We have Josh Hawley, who is against these Medicaid cuts. We have Rand Paul, who is against the bill for various reasons. But then there is Susan Collins and Lisa Murkowski on the Republican side as well. And for these reasons, I think that the Republicans in the Senate will be more inclined to rewrite the whole bill.
Interesting. We'll be watching for that. And I know we have a few minutes left, but I wanted to touch on Medicare. I know you've been advocating for expanded coverage, with acupuncture, nutrition. Wanted to you to tell us about that legislation.
So there are eating disorders amongst older adults, but the coverage for that is very meager in Medicare. So there is not the recognition that there should be about these eating disorders. And you can only get treatment for it if you have a particular, like diabetes and some other condition. But in reality, we need to have coverage in Medicare for eating disorders. So that's what my bill does. And I do have bipartisan co-sponsorship. So that makes me feel that this could be on its way to success. Acupuncture is another treatment that could be very beneficial to the seniors in our nation. First of all, for such conditions like pain, but other conditions, acupuncture could be so beneficial. With regard to pain, many seniors don't want to have opioids. They don't want to get addicted. And acupuncture is the perfect solution for them. And yet, acupuncture is not fully embraced by Medicare. Now, we did make a breakthrough just a few years ago when acupuncture was approved by CMS as a method to deal with pain. So that was a good first step, but the problem is that it didn't say that acupuncture could be administered by acupuncturists. So they are the ones who should be administering it. So that's what my bill does. It says that acupuncture should be administered by acupuncturists, and then we would have a full ability for seniors to be able to access this treatment.
Very good to know. Congresswoman Judy Chu, thank you so much for joining us today.
Thank you.
Thank you.